25 شكله. ختامها مسك دائما، ده المنشط الاخير في 2025. وحنبتدي ان شاء الله بعد الامتحانات 2021 2026 ان شاء الله. فاي زول ما قدم، انا عندي الليسته، هم عارفين عندي اسماء كل الناس اللي ما قدمت، دفعه قديمه ودفعه جديده. فاي زول ما قدم احسن يتقدم براه، بدل ما نقول تاني نقول الاسماء اللي عايز يخش منو يا اخواننا يقول يخش طوالي مع دكتور ياسر.
احنا كلارا دي عملناها مشكله ولا كان زول تاني؟
والله ما بتذكر كلارا دي، والله اسم كلارا دي اسم ما غريب علي غايته، الا يكون في
الشباب
كلارتين.
الناس دي بتذكرهم، انا افتكر انانيا ذاته عملناه.
ديل شفناهم يس.
انا ما اتذكر كلارا.
طيب.
لا ما افتكر القصه ذاتها، يعني اتس فيري نيو.
مم. مم.
في زي متذكر اذا كلارا اشتغلناه ولا لا؟
لا
اشتغلناه
لا،
كده.
دي اشتغلناها.
اوكي.
اشتغلناه.
معناه اللي
والله
بعدها
ايوه.
كلارا
طوالي.
افتكر ما اشتغلنا معاه
لا
فعلا.
لا لا، اشتغلناها في السوماتو.
سوماتوفورم
اي
اوتس.
كلامكم صح، كلامكم صح. معنا بس عندنا مارك طوالي من المتبرع الليله.
اللابسه هنا دي هودي دي مش اشتغلناها برضه يا ياسر، اللابسه
ما
هودي.
افتكر ما افتكر.
يا دي قرا لنا قصتها كده نشوف.
Laura Hayles is a lady who has been referred to outpatient clinic by her GP due to increased anxiety and repetitive behavior. This is taking a significant toll on her work and friendship. ما افتكر.
والله ما غريبه علي. طيب والفوق
ولا
ده منو؟
ولا مارك الفوق ده ما
ولا
ذكر.
ما اشتغلنا.
اي
اوكي. طيب.
فولنتير.
هسي الساعه فاتت 17 دقيقه، 17 دقيقه، والحضور 38، نقسم منهم الاساتذه يعني الحضور حيكون 30 ولا 35 من 104. It is shameful والله العظيم. It is shameful.
يا اخوانا عيني الناس ما تتلكلك طوالي، بس واحد يتبرع وبعدين يعني we're gonna prime them قبال ما يبتدوا. يا اخوانا، يا جماعه، بقينا 37 في زوزان.
ايوه في زول زق عشان ما عايز يناقش يسالوه. ما كده بس، التكنيك بقت انه الناس بتخش متاخره بعد ما الناس تبتدي تو انترفيو الكيسز. يو جوت مي.
يا
طيب.
اخوان، والله الموضوع الناس بتتعلم والناس ماشي ماشي، المستوى ماشي متحسن، وقبل ما نبتدي الكيس we're going to remind exactly what to do.
والمشكله الاكبر من دي انهم، انا ما اتكلم عن كل الناس، some of them they think انه we are not aware of this. We are aware of this. يعني كل هذه we are aware of it يعني. يا عملناها زمان يا ابن عملها، شفنا ناس عملوها. ف... فما لا داعي للتحاذق.
وانا الموضوع ما صعب شديد يا اخي، الناس يعني واحد يدق شفت يدق صدره ويتبرع.
وانا عايزك يا ياسر لما تقرا لهم
هاي.
تركز لهم على الاسئله المفروض يسالوها. ما هو بيقول لك كده في السيناريو، يقول لك يو اسك اباوت كده 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 كده، صح؟ بيقول لك اسال. فالزول يا اخواننا اللي عايز ياخذ الكيس دي حسي يجهز ورقه وقلم ويكتب الاسئله حقولها ياسر، وبس انت اسال الاسئله دي تاني بس للبيشنت. الاسئله المفروض تسالها للبيشنت حيقولوها لك.
وقبال ما
الاسئله المفروض
نبتدي
تقراها.
الاسئله ذاتها I'm going to remind people what to do في البدايه، كيف تبدا الموضوع وكيف يعني to go through it. عامر، شبكتك كيف والميكروفون بتاعك بس يكون قريب عشان بس ما تحصل
عامر
لخبطه.
كان معنا المره اللي فاتت يا ياسر. عامر
ما
قدم
في.
في الموك اكزام. لا لا، ما انا لحد حسي بقول الناس اللي ما قدمت قبل كده يا عامر معلش، شكرا لك. شكرا لك. الا لو عايز تقول حاجه ثانيه، لكن الكيس انت قدمت الاسبوع اللي فات. آيات قدمت. إيمان بشير قدمتي قبل كده؟ إيمان بشير، أنا ما عايز أجيب الليستة بتاعتي. دكتورة
يس
إيمان بشير قدمتي؟ قدمتي؟ تمام.
لا
آلاء قدمت افتكر، آلاء عبد الهادي.
إيمان قالت ما قدمت.
ما قدمتي يا إيمان؟
لا كان بديت
طيب
حصلت
قدمي.
لي مشكلة ووقفتها.
صح. طيب ممكن تقدمي تاني؟ لو حصلت لك مشكلة قيفي.
تمام ما في مشكلة.
يديك العافية. يلا ابتدي أقرأ لها ياسر ووريها بالضبط تقول شنو. شكرا.
طيب. Mark Hannard. A scenario: Mark Hannard has been struggling with depression for over a decade and has tried multiple medications and psychotherapies without significant improvement. His current medication regimen include fluoxetine and bupropion, but he reports persistent low mood, anhedonia, and suicidal ideations. Mark's wife, who accompanies him, is increasingly concerned about his well being and is eager for a new treatment approach. He's keen on discussing ECT. Since this is your first time meeting Mark, take a detailed psychiatric history and risk assessment. So it's basically حتى مع ال ECT a discussion ما طالبين الكلام التاسك. It's just a history وفي الهيستوري depression. كويس؟ البري ريدنج المانجمنت managing treatment resistant depression. انا افتكر التاسك هنا is already about establishing that this is treatment resistant. يعني ليه احنا we want to know more about قبل ما نبتدي. We want to know more about what is going on with this patient, what is bringing him, for how long his depression has been going on, what is depression like this depression for him, how it's been impacting his life. نتكلم عن الشغل، نتكلم عن الماريتال ريليشن شيب، نتكلم على ال ability to enjoy life to begin with, hospitalization, previous medication trials, failures of trials, the impact of depression on his life. وبعدين نتكلم عن ال response to different treatment. بيتكلم عن ال either response الليلة are they responding well, he is responding well, a symptoms improvement, a tolerability of the medications, in any problematic side effect that he could not handle. وبعدين بتتكلم عن الليلة previous suicidal attempt, a risk assessment. For treatment resistant depression, you always have to rule out in الليلة you're not dealing with bipolar depression. فهتسأل الليلة في إذا كان في history بتاع manic symptoms ولا ما في manic symptoms. وبعدين بتتكلم عن what is his interest. فنتكلم في البري reading again. البري reading material diagnosed designed to prepare doctors for a simulation involving a patient Mark Hannard, who has been struggling with treatment-resistant depression. The focus will be understanding treatment-resistant depression in the context of ICD-11 and NICE guidelines, developing effective communication skills for discussing sensitive topics such as ECT therapy, or the electroconvulsive therapy, and formulating appropriate questions to understand patient condition and preference better. Definition: according to the ICD-11, treatment-resistant depression is characterized by lack of sufficient response to at least 2 different antidepressants given at adequate doses and duration during a current depressive episode. NICE guidelines, the National Institute of Health and Care Excellence, recommends considering ACT for adults with severe depression that has not responded to pharmacological treatment and psychotherapy. It is crucial to discuss risk, benefit, potential side effects of ECT with patient and their family. Communication skills, empathy and active listening. بس عشان الempathy and active listening دي افتكر مرة مرتين في الآخر انت when the patient is telling you they've been dealing with depression, you can say I am sorry I'm sorry to hear about what you're going through and I'm hoping we can help you with your depression. مرة مرتين وكفاية. يعني في الآخر it's كتورة ذاته ما حلو. Demonstrating empathy and active listening to the patient concerns are crucial. Acknowledge the difficulties they are faced with, their condition, and the impact it has had on their life. Discussing ECT. When discussing ECT, use clear, non-technical language. Explain the procedure, effectiveness, potential side effect, and the usual course of treatment. Reassure the patient that ECT is considered when other treatments have not been successful and aimed at providing relief from severe symptoms. كويس. Involving the family. Given Mark's wife concern, it is essential to involve her in the discussion with Mark's consent to ensure she understands the treatment plan and provide support. Question to ask Mark. History. اللي هي history بتاع depression. Just pay attention to this. Can you tell me more about when you first started experiencing symptoms of depression? More like an open-ended question. How have these symptoms changed or progressed over time? Previous treatment. Can you
معلش
list?
ياسر
أيوه.
معلش ياسر عليك الله. كل سؤال قوله مرتين عشان إيمان تكون
Okay.
يا بتلقى فرصة تكتبه يا يس معلش.
Okay. في history of depression, can you tell me more about when you first started experiencing symptoms of depression? That's the first question. It's an open-ended questions aimed to start to understand when was the first time ever the patient had depression. وبعدين you want to ask about the progress of the illness until the patient came in. How have these symptoms changed or progressed over time? ده السؤال الثاني. بعدين انت عايز تسألي من previous treatment and response. Can you list the medications and therapies you have tried in the past? Again, can you list the medications and therapies you have tried in the past? Next, how did you respond to these treatments? Did you experience any side effects? How did you respond to these treatments? Did you experience any side effects? Again, عشان انت to establish ان الموضوع ده it is treatment resistant depression. Is it and again وبعدين في حاجة تانية أنا أضيفها. I would like to know about the adherence to treatment. Were there any time when you were not taking the medication as prescribed? Non-adherence is very important to rule out treatment-resistant depression. Current symptoms. Can you describe your current mood and any other symptoms you are experiencing? Again, can you describe your current mood and any other symptoms you are experiencing? Next, have you had any thoughts of self-harm or suicide? Have you had any thoughts of self-harm and suicide? Understanding and expectations of ECT. What do you understand about ECT? What do you understand about ECT? This is an opening statement عشان تعرف what is his level of knowledge about ECT so you can build on. Next, what are your expectations or concerns regarding ECT as a treatment option? Okay. Support treatment. Who do you have in your life that support you? Support system, sorry. How do they support you? Who do you have in your life that support you? And how do they support you? How does your current condition affect your relationship and daily life? How does your current condition affect your relationship and daily life? Finally, a risk assessment. Have you made any plans or taken any steps toward self-harm or suicide? Have you made any plans? Have you made any plans or taken any steps toward self-harm or suicide? Do you have access to means of self-harm or suicide? Do you have access to means of self-harm or suicide? Okay. The pre-reading material aims to equip you with a functional understanding of treatment-resistant depression, guidelines for considering ECT, and strategies for effective communication when the patient is facing challenging questions. During the simulation, focus on building a rapport with Mark, understanding his journey, and addressing his concern about ECT comprehensively and compassionately. طيب انا لحد هسه ما شايف انه يعني في requirement ان to ask about to provide information about ECT. لكن لو discussion من Mark ولا his wife she asked you about can you tell me more about ECT ممكن تقول yes definitely I'm happy to tell you more about ECT. It is one of the most effective treatment options we have in psychiatry, especially for treatment-resistant depression. People with treatment-resistant depression typically don't respond to medications, but when they approach ECT, the response can be extremely helpful and high. كويس? And they get many patients who come to ECT get relief of their symptoms of depression and they feel better. The treatment is generally done under anesthesia and it is brief. The whole treatment does not take more than a few minutes. We ask you to come, like we ask you to be fasting when you come for treatment, and um, and when you come and you get assessed by your family by your PCP before you come for treatment, we apply a calculated electricity to certain parts of your brain, and this induces a seizure, and the seizure is brief, and the seizure is believed to help with treatment. Typically, most people respond to treatment after 4 to 6 treatment, with some people responding to treatment before that, or some people requiring more treatment. It is helpful for severe depression like yours, who did not respond to previous medication management. It is safe, considerably safe, and very effective. Some of the side effects known to ECT can be memory problems, headache, and muscle pain. However, with the memory problems, we have some techniques to try to reduce the frequency of any memory problems. And it's not permanent. You're not going to forget about your family or forget about many most important information about yourself.
تمام ياسر، لكن وضحت لهم برضو انها it is conducted under general anesthesia.
هذا في الأول.
Very good. تمام.
اوكي. طيب يلا لكينا في الاخر يا ايمان، الكلام هنا في الاول عن الدبريشن. Mainly the focus is going to be on the depression, the journey of their depressive symptoms, the response to treatment. And أنا ممكن برضه to exclude any bipolar symptoms.
هما بص لو بدوا لي مثلا في
مم.
الهيستوري بالاي سي تي، انا كيف اخليه يمشي لي اول على الستبس يعني؟
كده معلش ممكن تقولي كلامك تاني؟
هو لو قلت لك لو بدأ اول الكونسيرن حقه بالاي سي تي، انا امشي معاه في نفس المكان؟
قول له جدا. احنا I'm happy to help you and talk to you about ECT, but before we talk about ECT, I need to learn more about your depression in order to know if this is a good treatment for you or not. So let's start from this point. Just redirection. لأن الفوكس هنا depression. Okay?
اوكي.
just basically again زي أي conversation مع أي زول، زي التمثيلية الموضوع ده. كويس؟ Good morning. مثلا, hello, my name is Dr. Iman. I'm the psychiatry resident here, and I'm here to talk to you about your concern. Can you help me to understand what brings you here today? خلاص دي open-ended question، وبعدين الليلة هنا ممكن هو ومرته يكونوا موجودين. وبعد شوي مثلا قال لك I'm depressed, I've been going through this for many times, and I'm sorry to hear about your journey with depression. And I'm happy that you came here so we can try to help you with your symptoms. So can you tell me more about your depressive symptoms? When did you start having these symptoms? ده اللي هو الكويستشن الأول. وبعدين هو هيديكي مثلا الليلة هيشرح لك السيمتومز بتاعتها. انت you want to know about the progress زي ما قال لك هنا. Over time. How did these symptoms progress over time? What have you tried like هنا? Can you list the medication and therapies you've tried in the past? And how did you respond to this treatment? Did you experience any side effects? أنا هنا ده ممكن كمان أسأل على الليلة على where you take it, like did you struggle with taking the medication consistently during that time? Adherence is important. وبعدينك هتmove to current symptoms. Can you describe your current mood and other symptoms you're experiencing? وبعدين you want to know about the safety. Any thoughts about suicide or self-harm? عايز تتكلم عن الامباكت بتاع الدبريشن عليه on his life, on his support, what kind of support does he have. وبعدين كان ليه لو دخلت الدسكشن على الدبريشن على الاي سي تي، بتتكلم عن الاي سي تي. Tell me what do you understand about ECT. What are the expectations or concerns regarding ECT as an option. وبعدين كان ليه اذا سألك هو انت بعد شويه تشرح له حبه من معلومات الاي سي تي دي. تمام؟ اوكي.
تمام.
اوكي اللي هو السيناريو again مارك هانرت. ممكن تسميه يعني تبغى introduce him by Mark. افتكر you can go with his first name عادي. Has been struggling with depression for over a decade and has tried multiple medications and psychotherapies without significant improvement. His current medication regimen include fluoxetine and bupropion, but he reports persistent mood anhedonia and suicidal ideations. Mark's wife, who accompanies him, is increasingly concerned about his well-being and is eager for a new treatment approach. He is keen on discussing ECT. Since this is your first time meeting with Mark, take a detailed history and risk assessment. Okay, we're going to start.
Thanks for seeing me. I have to admit it wasn't easy coming in to discuss ECT today. It's quite daunting for me. I've heard some scary things.
Hi, Mark. I'm Dr. Iman. I'm the attending psychiatrist here to help you. Would you please tell me about your symptoms? How did it start and when it started? When did it start it?
It started about 10 years ago, maybe a bit more. I just began feeling empty, like nothing mattered. Over time, it got worse. Lost interest in everything, couldn't enjoy things, struggled to get through work. It's been constant, no real relief.
Mm. How these symptoms change or progress over time?
It's just gotten heavier, honestly. At first, I thought it was just stress, but the emptiness never left. Now, even on good days, I feel numb. It's harder to concentrate, harder to care about anything. Most days, I just feel worn down and hopeless.
It's very hard to feel like that. I'm really sorry. I'm here to help you. Please, could you help me if you face at any time any symptoms of high mood, elation?
No,
Hello,
I've never
Mark?
really had times where my mood goes up. I don't get bursts of energy or feel unusually happy. It's always just been low, flat, really. No high periods, just the same heaviness day after day.
Okay. How about your relationships with peers and with your friends, family?
Most of my friendships have faded. I barely see anyone except Emily. Even with family, I keep my distance. I just don't have the energy or interest anymore. Emily does her best, but I know it's hard on her too. I feel pretty isolated.
Could you please tell me uh, about your sleep?
Sleep's a mess, honestly. I either can't fall asleep or I wake up way too early and can't get back to sleep. Even when I do sleep, I never feel rested. It's exhausting.
Yeah, it's very hard to feel like that. How about your appetite?
Work has become really difficult. I used to be passionate, but now I struggle to focus or finish tasks. My performance has slipped. Honestly, I'm thinking about taking a leave, but that feels like giving up. It's just hard to care about anything at work anymore.
Did you before have special hopes or interest in some activities or enjoying any activities?
I used to love hiking and woodworking. Those were my escapes. I organised trips with friends, built things in the garage. Now I don't even bother. Nothing feels enjoyable. It's like everything that used to matter just stopped mattering. I miss that part of myself.
Could you please tell me about your thoughts, about your ideas to
I'm not
do?
sure I understand if you mean thoughts about not wanting to be here. Yeah, I have those a lot. It's pretty much a constant thing. Sometimes the thoughts get really strong. I try to keep going because of Emily, but honestly, I feel hopeless most of the time.
Do you have any do you hear any sounds that people not hear it, or do you see anything that people not see it actually?
No, I don't hear or see things that aren't there. It's not like that for me. It's just the depression, no hallucinations or anything like that, just this constant heaviness and emptiness.
Okay. It's really hard to pass through this, but I hope you will get better. How about your medication?
I've tried quite a few medications over the years. Right now I'm on fluoxetine and bupropion. Honestly, they haven't made much of a difference. I still feel the same. Low mood, no motivation. Nothing really helps. It's frustrating.
Yes. Did you take it regularly on time?
Yes, I've been taking my medication as prescribed. I don't miss doses. I followed the routine exactly, hoping something will change. But so far, it hasn't made much of a difference for me.
Okay. How about your ideas? Do you have any ideas of harming yourself?
I don't think much of myself these days. I feel like a burden to Emily. Like I let everyone down. At work, with friends, even just being around. Most of the time, I honestly feel worthless.
Did you have any plan in the past, or did you try to harm yourself in the past? Not now, in the past, I said.
Yeah, I tried to help myself. Therapy, different medications, even lifestyle changes like exercise and diet. I threw myself into hobbies, tried to reconnect with friends. Nothing really worked. I kept hoping something would, but it never did.
Okay. I mean, did you try to kill yourself or doing something harm to yourself in the past?
Yes, I have thought about it a lot, and there were times when I came close. I never actually went through with it, mostly because of Emily. But those thoughts are always there, and sometimes they get overwhelming.
Mm. Could you please describe your
Are you
current
still
mood?
there?
Yes, I'm still there. Can you describe your current mood and any other symptom experiencing now?
Right now, I just feel numb and empty, like I'm here, but not really living. No interest or enjoyment in anything. Can't concentrate, always tired. The suicidal thoughts are still there, just quieter some days than others. I feel hopeless most of the time.
Did you try anything to relieve the symptoms rather than medication? I mean, did you try to drink alcohol much or to try some substance?
No, I haven't turned to alcohol or drugs. I know that's not the answer. I've tried therapy, exercise, routine, but nothing seems to lift the fog. I just feel stuck.
Hmm. Who do you have in your life that support you? You said Emily most of time. How do she support you?
Emily is always there for me. She listens, encourages me to keep trying, makes sure I take my meds and go to appointments. She keeps things running at home when I can. Honestly, I don't think I'd make it without her.
Is your current symptoms affected your relationship with Emily?
Yes, it's affected things a lot. I'm distant and it's hard for me to connect. She tries her best, but I know it's wearing on her. We don't do much together anymore. I feel guilty for what she's going through.
Yeah, it's very hard to feel like this and to pass through all this experience. I hope you will get better soon.
Thanks, I appreciate that. It's hard to believe things could change, but I'm here because I'm willing to try something. anything that might make a difference.
Did you try any other mode of treatment rather than medication? I mean ECT or psychotherapy?
Yes, I've tried different kinds of therapy, CBT, talk therapy, even group sessions. Lots of medications, combinations. Nothing's really helped. That's why ECT is coming up now. Honestly, I'm desperate, but also scared about it.
What did you know about ECT?
I know ECT is used for severe depression when other treatments haven't worked. It involves electrical currents to the brain under anesthesia. I've heard it can help, but I'm worried about side effects, especially memory loss. There's a lot of stigma around it, so I'm pretty anxious about the whole idea.
Okay, I will tell you a little bit about ECT. ECT is a
That would be
best tool for Okay, I'm pretty sure to help you. Um,
Thank you. I
ECT,
really hope so. I'm just so tired of feeling this way all the time. If there's a chance ECT could help, I want to understand it fully before deciding.
yeah, you are welcome, Mark. ECT is a tool that's used for treatment of resistant depression when two or more medication was used without benefit, like in your situation. ECT is generated under general anesthesia. Is it clear till now?
Yes, that makes sense. I
Mark?
understand it's for people like me who haven't responded to other treatments. I'm still worried about the risks, though, especially memory problems. How common is that? And is it usually permanent?
About the risk, actually, it's really safe or relatively safe procedure. You might have some pain or in your muscles or just a headache. Before that, you have to be fasting, and there is some precautions if you have any medical condition like tumor or it is should be excluded. I think it is just a few minutes procedure. About memory, it is not a long-term memory loss. You are not gonna lose your past memories with family, or it's just about the recent memory. I think I will tell you. I will let you to ask me if you have any question.
Thanks for explaining. So, if I understand right, the memory issues are mostly with recent memories, not old ones. How long does that usually last? Do most people get their memory back, or is it sometimes permanent? I just want to know what to really expect.
No permanent memory loss for the past. It's just for the recent events. And
Okay, that helps a bit. I still worry about
about what?
losing
You're
how
still
often that
worried.
happens, and if people regret doing ECT because of.
Please, could you ask me again?
Because I'm scared of
I
losing
didn't.
more than just memories. Sorry, I just meant, do people ever regret having ECT because of the memory loss or other side effects? I want to know how likely it is to feel worse after, not better.
No, most of people become better after ECT. They improve. It's very safe. As I said, there is no harmful. It will be generated under many precautions, so you will not harm yourself or just like moving your hands, not like just electricity for certain areas, not like a convulsion. You will not have any serious event. Just you may have a headache or body aches for a while.
All right. Thanks for being honest. I guess I'm just desperate for something to work, but really scared of being disappointed again. I just need to know we're not missing anything or that I'm not making things worse.
No, it will not. I want to ask you about your wife visit with you now, or Emily, I said.
Yes, Emily's here with me. She wanted to be part of this since she's been supporting me through everything. She's just as concerned about the risks and really wants to understand what ECT would mean for us both.
I'm glad here. I'm glad to see to hear that you have a supportive family, and they are coming and concerning about you. And I'm here to tell her whatever she wants. If you want to ask something.
Thank you. That means a lot to both of us. Emily's been carrying a lot on her own, so having things explained clearly helps. She might have questions too, if that's all right.
Okay. If I can, if I could provide help, I would not do the against.
We appreciate that. Honestly, I'm just hoping something will finally make a difference. It's hard to hold on to hope, but we're here because we want to try.
Did you work, Mark, or you lost your work? You didn't tell me about your occupation.
I'm an engineer, used to really enjoy it, solving problems, working on projects. But lately it's been a struggle just to get through the day. My performance has dropped and I'm considering taking a leave of absence. That feels like a failure.
Mm-hmm. It seems very difficult. Did you ever been hospitalized due to depression? I think.
No, I haven't been. No, I haven't been hospitalized for depression. I've managed to stay out of the hospital, mostly because Emily keeps an eye on me. But there have been times when it felt close.
Mm-hmm. Okay. Sorry for that. I want to ask you
I'm not
again.
sure what you mean by 8. Could you clarify your question?
I want to ask you again about any
No problem.
ideas about
أكيد
suicide. Did you
إن شاء الله.
wrote any notes or
The thoughts
any
are still
current
there,
ideas?
honestly. Most days they're just in the background, but some days it's really strong. I haven't made any plans recently, but the hopelessness never really goes away. It's exhausting to keep fighting it.
Thank you so much, Mark. Did you have any question before?
Are you still there?
Yes, I'm still there. Did you
Yes,
do you have
really?
any questions?
If ECT doesn't help.
No. What?
Sorry, could you repeat that? I'm not sure what you mean. Could you say that again?
Sorry, Mark. I'm telling you that I want to know if you have any question before we end this session.
Thanks for asking. My main question is just about the real chances of ECT helping someone like me. What are the odds it actually works? When
طيب، شكرا لك دكتورة زينب. بس غايته في الكويستن اللي هو سأله، أنا أفتكر يعني دقيقة، أنا صوتي ظاهر ولا عامل ميوت؟ دقيقة.
يلا ظاهر يا بس.
اوكي. طب الكويستن ذاته بتاع الافيكاسي بتاع الاي سي تي. الاي سي تي is effective in almost 80 to 90% of patients with major depressive disorder. ده بنتكلم عن treatment resistant depression، البرسنتج بتكون almost from 50 to 60%. بالنسبة للميموري problem، usually زي ما انت قلتي الميموري problem is usually for reason memory and it's usually transient. Most people have their memory improve within a couple of days to weeks once the ECT frequency is reduced, or if it happens, we can change the modality of how we perform ECT to minimize the impact on the memory. Many people, وبعدين بيقول لك ساعات many people, they come with memory problems because of their depression. And we've treated that when we treated them with ECT, their depression improves. And even sometimes some of these people who came with memory problems, they have improvement in their memory because of ECT. فدي الاسئله الباكج دايما بيسالوها الناس عن الميموري، لانه it's a very important question. دايما الناس بتجي عشان الاي سي تي تسال السؤال ده، بيخافوا من الميموري ايشوز. فدي صار reassuring يعني ستيتمنت للدسكشن على الميموري، او بالذات الميموري بروبلم فور اي سي تي. لكن كده بنرجع تاني بالنسبه للاوفر اول. قبال مثلا الليله اسالك السؤال عن انت how do you think you've done overall، انت you covered all the major areas كويس، وغطيتي الاسئله. يمكن struggled حبه في حالات معينه، لكن الميجر ارياز العيان جابيها انت you covered them all كويس. فده is good work. زي ما قلنا انه في progress حاصل في المستوى بتاع الناس. لكن اول حاجه اسالك انت what do you think has gone well, what do you think has been like can be an opportunity for improvement.
Um, going well إن البيشنت كان cooperative وcalm وهو اداني يعني ما he give me the ease to ask him and he understand my language even not that good. Uh, he just understand my questions. And not going well, I have to prepare myself more. Really, I know how to talk in English, but I don't know
You're
why.
practicing, well, you're doing well with the practice. والانسر للpractice is more practice. You're doing well. I think you've done well. انك اول حاجه to stand up و to continue الموضوع للاخر. You've done great. It just requires more and more practice. عشان كده اي فرصه تلاقي فرصه تعملي زياده this will get better.
Yeah,
الefficiency التايبس بتاعت الكويستشن this is definitely going to improve. لكن من ناحيه انت غطيتي الاسئله.
thank you. going better إنه أنا ما وقفت فعلا زي ما قلت يا بس
تمام.
like the previous.
تمام. وده المطلوب في الاخر انك تستند الموضوع ده، لانه البروسيس عباره عن في الاخر it's a different process للناس دي كلها. الكوميونيكيشن it improves by practice. لكن انت you had a theme, you had يعني specific question you asked. صحيح مثلا في ممكن نتكلم عن التفاصيل بتاعتها بعد شويه، لكن generally انت you covered the task requested كويس.
Thank you.
يلا بالنسبة لأول حاجة مثلا what went well، العيان إنه to be cooperative ولا ما cooperative دي ما حاجة بالضرورة تتحكي منها went well. Some patients are easy و some patients are difficult. Whether the patient
Yeah.
is difficult or not دي ما غلطتك أنت. يعني ممكن لو جاكي في الامتحان هسه مثلا عيان مثلا جابوا لك سيناريو عيان difficult، ساعات بتجي as a session. يعني مثلا الليل لو عملنا مثلا mock interview ولا أي mock مثلا patients، ممكن يكون في واحدة من الكيسز a difficult patient، انه يكون صعب ولئيم واي حاجه. ف handling a difficult patient is a task. فهو كونه هو difficult ولا easy ده ما حاجه مثلا الليله حاجه كويسه كويس. يعني this is it's a matter of luck. بتكلم عن الليله what did you think you've done well. انا ممكن اغطي
Um,
لك الحته دي. انا I think انت you covered the major areas بتاعت الانترفيو، وانت ووصلتيها للاخر حتى despite the struggle you وصلتيها لحد الاخر. ف this went well. نسأل الشباب what else could have been done differently. الناس دي نايمة ولا شنو؟
Maybe to explain
ايش
more
موضوع
about
الاي سي تي دي
ECT.
بس يعني؟
طيب واحد بس الأول.
طيب
Okay,
عن
maybe
اذنك
if
دكتورة
she
رنا.
explain more about the ECT على أساس إنه هو he seems is not convinced شديد. He
أي.
keeps asking and going and telling again. فأفتكر هي لو كانت شبعته شوية في الكلام about ECT maybe.
ودي اتس نولج ثينج، لانه هنا دي مثلا الليله في السودان يعني معظم الاماكن مثلا ما كل الاماكن في اي سي تي اندر انستيزيا، والميموري بروبلم يعني الناس ما سوفيستيكيتد عشان يسالوا عن الميموري بروبلمز في، لكن مثلا النولج بتاع الناس اتغير. لكن السبيسيفيك هنا اتس ا كومن كويستشن expectation اللي هي مثلا with numbers، يعني بيحاول يقول لك what is my chance. فباي numbers اللي هي الريسبونس دي انت you have to know it as a part of knowledge. 80-90% of patients with depression they get better with ECT. With treatment resistant group we're talking about 50-60% of patients. الميموري سايد افكتس بنتكلم عنها اللي هي معظم احنا بنتكلم عن recent memory، ونتكلم it's usually temporary and most people they have their memory improved within a couple of weeks after stopping ECT or after reducing the frequency of the treatment. ممكن ساعات إذا عايزين نخش في التفاصيل التريتمنت usually in the beginning when people have severe symptoms بنتكلم أن the treatment happens at least sometimes twice or 3 times a week, and then once the symptoms improve the frequency is reduced. Average number of treatment is usually can be between 6 to 12 depending, and some people might require fewer, some people might require more. فدي specific information للاي سي تي زي ما قال دانا تاني. افتكر يوسف كان بيقول حاجه what
نفس
else؟
الشيء كان انه بس الاي سي تي هي ما يعني ما موضوع النولج زي ما قلت، اكثر من انه الموضوع هو النولج، وبرضه البيئة بتختلف من مكان للتاني، فأي ناس عندهم كونسيرنز، عندهم الحاجات اللي عايزين يسألوا عنها. يمكن البيشنت ده لو كان في السودان كان أسئلته بتكون مختلفة، نفس الكلام ده.
بالضبط.
وانت برضه
بالنسبه برضه يا ايمان بالنسبه للكونترانديكيشن ما بنقول، احنا بنتكلم it's a relatively safe بالنسبه للسيفتي بتاع التريتمنت. It's a very safe treatment in order to make sure يعني انت you have the most benefit of it. We want to make sure and your family physician or GP sees you before the procedure, just to make sure you don't have a problem that can get worsened with ECT. خلاص
Okay.
ما بنخش في الكونترا انديكيشن بتاع الهيناي سبيس اوكيباين ليجن ولا حاجه زي دي، لانه يعني ما شويه كده ما موضوعه، لانه ممكن ينطيك انا عندي سبيس اوكيباين ليجن ويطلع من الموضوع ده، فما بنخش فيها. لكن نتكلم عن الجي بي لانه they need to see you to make sure it's a safe procedure for you. لكن it's a relatively safe treatment and any risk can happen because of anesthesia and the risk is extremely low.
Okay.
It's a very general response، ما بنخش بالتفاصيل اللي هو السبيس اوكيباين ليجن والقصص دي. اي زر عنده
Okay.
تعليق ثاني؟ طيب انا في حاجه بس الليله بنتكلم عن الريسبونس بتاع البريفيس تريتمنت اللي هو بس ما شوي explored. What treatment have you tried before؟ هو قال I tried several medications and psychotherapy، وبعدين ابتدى يفصل في السايكوثيرابي DBT like cognitive behavioral therapy, interpersonal therapy, and I would like to hear more about medications. What medications have you tried? What was your response like to these medications؟ دي شويه بس ما سمعت تفاصيلها.
طيب لو سمحت لي ياسر، شكرا دكتور أيمن بشير. You did very well حسب تقييمي أنا. You have covered the most important and major areas. هو بس كان الكونسيرن زي ما دكتور ياسر وزملائك قالوا إنه about الميموري، وهو حتى سأل قال لك طيب الشورت تيرم ميموري ولا الريسنت ميموري is going to be permanent ولا just كانت ترد عليه في دي إنها it is just temporary يعني is not going to last for long. الحاجة الثانية الادهيرنس to the previous medications، يمكن هو ما كان بياخد ال previous medications عارف، لكن otherwise you did very very well. Thank you.
وبعدين
شكرا.
افتكر بالنسبه للكوميونيكيشن الريسبونس الموضوع ده براكتس براكتس براكتس. والله يعني the next time you try هيكون البرفورمانس بتاعك احسن. the third time you do البرفورمانس بتاعك هيكون احسن واحسن. لكن الحل للموضوع ده is practice. ما الناس تزوغ. ده الناس الزاغت وما قدمت. طيب
طيب ممكن just one point to make.
اتفضل.
يعني regarding this case, patient himself admit that there is no period who have been in which he have been feeling high. This is denotes unipolar depression.
كلامك سليم.
برضو yes وبالنسبة يعني إذا سأل عن إذا كان في to exclude first الميديكال illness. في medical illnesses can cause depression. أنا agree إن هو ده primary. يمكن الكلام ما في حاجة، لكن if you exclude medical diseases أو medical conditions it will be prudent يعني in this يعني session.
What common ones that they would have to ask this patient in particular?
I would like to exclude hypothyroidism in the first place.
Okay. Any health problems? Any problems with your
في others برضو
thyroid?
زي الاديسون disease.
ما خلاص انا افتكر. لكن ما هيستوري في الاخر
Yes.
انت ما بيدوك الورك اب هنا. الموضوع ده هيستوري. فانت المفروض في الحته دي تسال العيان any current health problems. Have you seen your GP? Did you do any current workup for depression, like such as your like did they examine your thyroid, check your thyroid function test, any other labs? بس فافتكر it's a good question.
اوكي.
طيب نخش في الكيس الثاني اللي بعدها. لورا عايزين الليله فولنتير.
يلا يا شباب. This would be the last case in 2025. It's a privilege.
والموضوع ما عايز تحضير بالمناسبة. أنا شايف الناس قاعدة مع إنك ما محضرة. المفروض الموضوع ما يكون فيه تحضير. It's a skill.
لا ما استحضر. ده بيشن بيجيك كده. This is a patient who comes يعني. ما عايز أي تحضير. يلا يا عمرو مصطفى التوم، يلا خش في الكيس دي. عمرو.
السلام عليكم.
عليكم السلام. قدمت يا عمرو قبل كده؟
نو دي أول
طيب
مرة.
يديك العافية. يلا خش ولا يهمك، داخل كيس وخلاص. يلا يا بابا.
طيب Laura Hayles scenario. Laura Hayles is a lady who has been referred to your
السلام
outpatient.
عليكم.
وعليكم السلام ورحمة الله. سامعني؟ عمرو؟ منو قال السلام عليكم هسه؟
ما ده عمرو معاك يا عمرو.
طيب.
ياسر حيوضح لك كل حاجة زي ما عمل مع إيمان، ويوريك الأسئلة المفروض تسأله ليها ويناي. أنت لو عندك عايز تكتب نوتس اكتبها أثناء ما دكتور ياسر بيتكلم يا عمرو. أوكي؟
عمرو أنت سامعنا؟
عمرو سامعنا لك. ميكروفونك أون يعني ما ميوت. صوتك اختفى يا عمرو.
عمرو؟
عمرو تقريبا في السودان، فغالب عنده مشكلة الشغل.
يعني صوته فجأة اختفى مع إنه هو موجود يعني. أوكي.
السلام عليكم.
وعليكم السلام. عمرو سامعنا؟
أيوة نعم.
يا عمرو قلنا لك دكتور ياسر حيقرا لك الكيس كلها، وحيقرا لك الأسئلة المفروض تسألها له. لو عايز تكتب نوتس وأثناء ما هو بيكتب بيقول لي في الأسئلة اكتب نوتس. نو بروبلم. أوكي.
سامعني يا عمرو؟ شايفك عامل ميوت.
نعم سامع. أيوة.
طيب يلا انا هجري الكيس. اوكي. لورا
طيب.
هي A scenario information. Laura Hayles is a lady who has been referred to your outpatient clinic by her GP due to increased anxiety and repetitive behaviors. This is taking a significant toll on her work and friendship. Task: take a detailed psychiatric history. Just a psychiatric history. لكن انت عارف ان الموضوع ده احنا بنتكلم عن anxiety symptoms with repetitive behavior. It sounds like more like OCD لحد ما نشوف التفاصيل هنا. معايا يا عم؟
نعم نعم.
تمام. OCD patient case. Laura Hayles. OCD is characterized by the presence of obsessions and or compulsions. Obsessions are intrusive, unwanted thoughts, images, or urges that cause marked distress. Compulsions are repetitive behaviors or mental acts that an individual feels driven to
ألو
perform. ايوه.
ألو
هاي.
ألو.
انا افتكر شوف لنا زول تاني، الموضوع ده انه هيقطع في النص.
يا عمرو انت سامعنا ولا ما سامع؟ سامعنا عمرو؟ يا it seems انه عنده مشاكل في الشبكة. it seems so. عنده مشاكل في الشبكة عمرو.
هاي.
ما هو قال خلينا نديه فرصة يا عمرو. سامعنا؟ مم. الظاهر ما سامع. آه. طيب نشوف ناس البورد العربي. دكتورة دانا مدثر دائما بتحضر معانا، هي في البورد العربي يا ياسر،
هاي.
ومشاركة في أغلب الحالات دائما معانا والله، ما في اللوكل. دكتورة دانا عايزة تقدم الكيس يا دكتورة دانا مدثر. ما سامعيننا يا ميكروفونك ميوت يا دكتورة دانا. هي قبل شوية مش كان دخلت في مداخلة مش كده؟
هاي.
مم. طيب نشوف زول تاني. هذه مشكلة البحث. الله. مم. طيب نشوف ناس من الدفعة الدفعة الجديدة، دفعة 50.
ناس بتبطل براوة.
هيفاء حاج موسى تفضلي تقدمي يا هيفاء.
أيوة موجودة.
عايز تقدمي يا هيفاء، ممكن تخشي في الكيس دي.
أيوة ما في مشكلة.
تمام.
تديك العافية. طيب اقرأ لها من الأول يا دكتور ياسر
طيب
عشان تركز معك.
كويس. OCD patient case اللي هي لورا هيلس. OCD is characterized by the presence of obsessions and or compulsions. Obsessions are intrusive, unwanted thoughts, images, or urges that cause marked distress. Compulsions are repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession or according to the rule that must be applied rigidly. ICD-11 classification. OCD is classified under obsessive compulsive or related disorders. It is important to differentiate OCD and other disorders within this category, such as body dysmorphic disorder, hoarding disorder, and trichotillomania, hair pulling disorder. NICE guidelines. The National Institute for Health and Care Excellence guidelines recommend offering cognitive behavioral therapy, specifically exposure and response prevention, as the first line treatment for adults with OCD. For those who do not respond to psychological therapies or where such therapies are not available, pharmacological treatments such as selective serotonin reuptake inhibitors or clomipramine are recommended. It is crucial to monitor the patient's response to treatment and any side effects closely. communication skills. يلا هنا الكلام. Okay. When taking a psychiatric history from a patient with OCD, it is essential to establish a rapport and ensure a non-judgmental empathetic approach. This similar to anybody أي عيان دي حاجة ثابتة. الكلام ده كله أي عيان الكلام الجاي. Patient might feel ashamed, embarrassed about their symptoms. Demonstrating understanding and validating their experience can encourage openness and honesty. أول حاجة open-ended question. Start with an open-ended question that allow Laura to describe her experience in her own words. كويس؟ يعني what so help like I mean good هنا. Hello Laura, I'm Dr. Haifa. I'm the psychiatry trainee here today. How can what brings you here today? Open-ended question. خلاص؟ And then بعدين في النص reflective listening. Reflect back with what Laura says to ensure understanding and show empathy. جبالك إيمان عملت الكلام ده. So help me to understand correctly, Laura. So you're coming here because you have these unwanted thoughts that have been bothering you, and there are some repetitive activities that you feel like they feel the compulsions to do, and this has been bothering you very much. Am I correct? This is a here example of the reflective listening. Reflect back with what Laura says to ensure understanding and show empathy. ممكن تقول it must be very hard for you to go through this experience. Really, you're trying to show empathy. Normalization, normalize her feelings and experience to elevate any shame or embarrassment. A good example لحاجة زي دي. I'm sorry about what you're going through, but you're not the only one who's dealing with these symptoms. We call this OCD. Many patients who have symptoms similar to yours come to our clinic, and we've been able to help many of them who came here with treatment. So you're in the right place. Normalize her feeling and experience to elevate any shame or embarrassment. Confidentiality. Assure Laura the confidentiality of the information she shares is within the limits of safety and legal requirements. This is a very safe place, and I need to assure you that everything you're discussing here is going to remain confidential. خلاص؟ Key questions. جاهزين ممكن عشان اللي تنتبه للquestions. Symptoms and impact. أول حاجة open-ended question. Can you tell me about your thoughts that bother you? ولا حتى كده. So what brings you here, Laura? Or what are you, like open-ended question. Can you tell me about the thoughts that bother you? The very specific question. هي في الآخر أنت what brings you here ده أول حاجة. لكن لما تقول لك أنا have these thoughts. If you get like these thoughts, can you tell me about the thoughts that bother you? What actions do you feel compelled to perform in response to these thoughts? What actions do you feel compelled to perform in the response to these thoughts? How do these thoughts and actions impact your work and friendship? اللي هي impact. How do these thoughts and actions impact your work and friendship? A duration and frequency. كويس. When did you first notice these thoughts and behaviors? When did you first notice these thoughts and behaviors? How often do you experience these obsessions and compulsions? انا ما حقول obsessions or compulsions الا اذا العيان قال لها obsessions or compulsions. انا حقول how often do you experience these thoughts and actions ولا behaviors. يعني it's becoming more technical لما تقول obsessions and compulsions. Previous treatments. Have you received any treatment for OCD in the past? Have you received any treatment for OCD in the past? What treatment were more effective or least effective for you? What treatments were more effective or least effective for you? Mental health history. Have you experienced any other mental health issues such as depression and anxiety? يلا هنا مع ال OCD دايما في comorbidities بتحصل. Depression is very common and anxiety is very common. لكن حتى مثلا psychotic symptoms can happen. ADHD can happen. Tics can happen. فدي كلها بتحصل مع ال OCD. لكن هنا specifically, have you experienced any other mental health issues such as depression or an anxiety? Is there a family history of OCD or other mental health disorders? Is there a family history of OCD or other mental health disorders? Functioning and coping. How do you cope with your symptoms? How do you cope with your symptoms? How have your symptoms affected your daily life and relationships? how have your daily symptoms affected your daily life and the relationships. And then في الآخر safety دي في أي حاجة. Have you ever had thoughts of harming yourself or others? Have you ever had thoughts of harming yourself or others? Well, do you have any current plans to harm yourself or anyone else? Taking a detailed psychiatric history from a patient with OCD requires a balance of clinical knowledge, empathy, and communication skills. By understanding the specifics of OCD as outlined in the ICD-11 and following NICE guidelines for treatment, you can provide Laura with best possible care. Remember, the goal is to make Laura feel heard, understood, and supported throughout the treatment journey. جاهزة هيفاء؟
ايه إجازة.
دقيقة بس عشان أقفل كاميرتي عشان ما نعمل distraction. Okay. Okay. Laura Hayes is a lady who has been referred to your outpatient clinic by her GP due to increased anxiety and repetitive behaviors. This is taking a significant toll on her work and friendship. Take a detailed psychiatric history.
Hello, thanks for seeing me.
Hello. Hello, Laura. My name is Dr. Haifa. How can I help you today?
I'd prefer if we could just get on with it. This is making me quite anxious. I'm here because my GP thinks I need more help with my cleaning and the germs.
You come here because you have a repetitive behavior of washing your hands, right?
Sorry, I'm not sure what you mean. I've tried everything I can to keep clean and safe, if that's what you're asking. My GP just thought maybe I needed more specialist help because nothing so far has really worked.
I am sorry about what you are coming through. Do you know the diagnosis of your disease? Or your GP tell you something about it?
Sorry, I'm not quite following. Are you asking about what my GP told me or something else? I was just
Yeah,
because my cleaning and worries about germs are getting out of hand.
I'm asking about what your GP tell you.
I haven't done DBT, if that's what you mean. I've only had some sessions with a psychologist about my cleaning, but it didn't really help. Mostly, I just feel like no one truly understands how constant the worry is.
Do you think you have do you think that behavior affecting your life?
Yes, it is. I can't focus at work anymore because I'm always thinking about germs and I've upset friends over it.
It is.
It's just taken
Can you
over.
tell me about? It is bother you, yeah, right?
Yes, it definitely is. I can't go a day without these rituals and it's exhausting. I just want things to feel normal again.
Do you think you have a problem?
Well, I know something isn't right. I just can't stop, even though it's ruining things for me. It feels like I don't really have a choice. I have to keep cleaning.
I am sorry to hear about that. Do you hear about a disease called OCD, obsessive compulsive behavior?
I'm not sure what you mean by social combustion behavior. I'm mostly just
No,
worried
no.
about germs and keeping things clean. If you're asking about being around people, yes, it makes me anxious, especially if I think they might be carrying germs.
It's about being anxious about germs. Do you have any suicidal or homicidal idea?
No, I don't have thoughts like that. I just feel overwhelmed and trapped by all the cleaning and worrying. I want help, but I don't want to hurt myself.
How do you cope with it?
I'm not sure what you mean by publish. If you mean how I cope, I just clean and
No.
clean until I feel a bit
Yeah.
better. but it never really lasts. The anxiety just comes back.
The time you take it to clean your hand, can you tell me?
I cope by cleaning everything around me.
Not
Using
just
tissue,
your hand.
wipes, and sanitizer over and over. If I can't clean, I get extremely anxious and can't focus on anything else. It's the only way I feel safe, even if it sounds a bit much.
Do you have any other health? Do you have any other health issues or mental health problem?
No, not really. I've not had any other mental health problems before this. Just the cleaning and worrying about germs has taken over lately. My skin's quite small, the scrubbing, but that's about it.
Do you have any family member with the same issues?
My gran had something like this, I think. She was always cleaning and worried about things being dirty, and she spent time in hospital a few times. Otherwise, no one else in my family has had it this bad.
What was the diagnosis of your grandmother?
I think they
She
said
has been diagnosed.
OCD. Wow, but I was young, so I'm not sure of all the details. My GP mentioned OCD when I started having these problems. That's all I know, really.
Do you know about the OCD, the disease?
I know a bit, yes. My GP and psychologist mentioned OCD, and I've read online about it. It sounds like what I'm dealing with, just constant thoughts about germs and needing to clean.
Did you try any treatment before or any psychiatric facility?
I've had some sessions with a psychologist, but it didn't help much. My GP put me on sertraline and increased the dose, but I haven't seen much improvement. I haven't been in hospital or anything, just outpatient appointments like this.
Do you have another treatment except sertraline?
I just want to feel normal again and not have my life ruled by these cleaning rituals. It's exhausting and lonely. I'm really hoping something here can help me.
What was effective for you to decrease the anxiety?
Sorry, I'm not sure what you mean by degree of anonymity. Do you mean how private this is? If so, I just want what I say stays between us.
Yeah. Everything you said, it is a safe environment. Everything you said, it will be for you, yani just for me and you. Okay. You said about having a psychotherapy, right? Laura?
Thank you for reassuring me. Yes, I've told you about my cleaning and how it's taking over everything. I just need some proper help with this because it's not getting any better on its own.
Yeah, I'm here to help you. I want to ask you about the psychotherapy you have it. How many sessions and do you have specific treatment? You try it?
I've tried talking therapy and I'm on sertraline, but neither has worked much. I clean all day, every day, at home, at work, everywhere. No matter what I do, the anxiety about germs just comes back.
Do you try something like psychotherapy called exposure and prevention therapy? Try you put your hand in the dirt or something.
Yes, and they tried to get me to touch things without cleaning, but I just couldn't handle it. The anxiety was unbearable, and I didn't feel any better after. It just made me more upset, honestly.
How many sessions you tried?
I had about 6 sessions with the psychologist. After that, they said we should try something else because I wasn't improving at all. I just couldn't stick with it. It felt impossible.
We can try it. Can you try it another time? Can you give it a try again?
I'm really not sure I can go through that again, to be honest. Last time I felt so panicked and overwhelmed. I didn't sleep for days. If there's another way to help, I'd rather try that first. The thought of exposure therapy just makes me more anxious.
We can try another drug, except for Citrine. You take the Citrine, right? Are you hearing me, Laura? Hello?
Yes, I can hear you. Sorry, I'm just feeling quite anxious about all this. Can we maybe talk about other options before pushing exposure therapy again? I want to feel
Yeah,
safe with whatever we try.
we have pharmacological therapy other than psychotherapy. Do you try Citrine, right? Before?
I'm not sure what you mean by staying dry. If it's another
No,
type of
no.
I haven't tried
I
it.
said,
I've only done where they tried to get me to stop cleaning, but nothing else specific.
what about pharmacological therapy? You try Citrine, right?
I'm
What
on
is the
sertraline,
maximum dose?
100
Yeah,
milligrams.
what is the maximum dose
I
you reach?
increased it a few months ago, but I haven't noticed much difference. I was told about fluoxetine, but I'm worried about side effects. Are there any other options?
Yeah, the gold standard is clobramine. You can try to increase the dose gradually.
I see. I'm just a bit nervous about changing medication again, especially with all the side effects people talk about. Could you explain what to expect if I switch to fluoxetine? I want to be sure before I agree to anything.
Okay. We will try to titre Citrine gradually. Then, can I ask you, fluoxetine, how do you know about the drug? Did your grandmother take it before? Or any family member take it now?
I don't know much about fluoxetine, just what I've read online. People say it can help with OCD, but also that it can make you feel sick or tired. I just want to know if it really works and if the side effects are bad.
Okay, it can really work. The side effects can last from 1 to 2 weeks. It nausea, some headache, and GI upset, but it will decrease with time. And the drug will work. We will increase the dose gradually. After a while, we hope the symptoms will disappear. We will try another round for.
Thank you for explaining. I'm just worried about feeling worse before I feel better. But if you really think it's worth trying, maybe I could give it a go. I just want some hope that things can improve.
Yeah, it will improve. It will take a little bit time to make it to things to be better. We hope that we are here with you. I hope you will try another round for therapy, for pharmacotherapy or psychotherapy. I hope things it will be better. We're here to help you, okay?
All right, I'll think about it. I just want to feel like myself again without all this anxiety. Thank you for not pushing me too hard. I'll try to keep an open mind about the medication.
Okay, thank you. Do you have any question?
Just one. How long does it usually take for the new medication to start working? And will I have regular check-ins to see how I'm doing?
It takes from 2 weeks to 1 month and a half. And we will increase the dose gradually. It is like a journey. We'll have to increase the dose gradually to see improvement. It will take a little bit time, but it was a try. I hope you see that, like I see it. Do you hear me?
Thank you for explaining. That helps a bit. Yes,
Yeah, I'm here for
Thank
you.
you for checking.
Okay, I'm here for you. If you have any other question, I'm here. Okay.
No, that's all from me for now. Thank you for listening and explaining things.
Thank you. I'm here trying to help you. Thank you. Thank you, Laura.
Thank you for your time. I really do hope something will help soon.
Yeah, I hope to. Thank you.
طيب يا دكتورة،
كان كيف؟
ده أسألك what was the task؟
آه أتكلم لها عن المرض.
منو؟
أتكلم لها عن المرض ال OCD.
That was not the task. التاسك أصلا ما كان discussion على ال OCD. التاسك was a history obtaining a history and clinical assessment. فأنت you should obtain الهيستوري بتاع ال OCD زي ما بدينا كان في الأسئلة في الأول اللي هي what brings you on here to the يعني هنا to the clinic. Tell me more about your symptoms اللي هي الأونست بتاعت السيمتومز، البروجريشن بتاعت السيمتومز، اللي هي بالنسبة لها الإمباكت بتاع الأكشنز ديل. ليها كم what she has tried what she has not tried any associated symptoms any associated illnesses الكورس بتاع التريتمنت الامباكت بتاع illness ده on her life. وبعدين while you're doing this you're trying to show empathy, you're trying to show validation, you're trying to do reassurance for the في الانترفيو ذاته, you're trying to validate مثلا to provide اللي هي basic to rehearsals الهيستوري اللي تاني. وبعدين الليل ما كان في اي حاجه لها علاقه بالدسكشن بتاع التريتمنت. It was history including even risk assessment، لكن ما discussion بتاع الاوبشنز اوف تريتمنت، دي ما عندها علاقه، دي كلها is trying to show the skills of obtaining history and communication skills، ما discussion بتاع التريتمنت. حتى انا شايف ان معظم الناس ساعات they try to jump into conclusion about what is this case about. الكونكلوجن ما عنده علاقه هنا. الكونكلوجن ممكن يكون على حسب المعطيات، انا عندي معطيات ونفس المعطيات بتطلع لنا حاجات مختلفه. It's about the process of how you collect the information.
أوكي.
هاي فشويه يعني افتكر دي كلها حاجات انك انت دخلتي معاها بس في المانجمنت immediately في دي كانت حاجات عن الهيستوري. It's a history of يعني ذات عشان كده قلنا ليك الليله امسك الاسئله دي ومثلا الليله هنعيد عليك مرتين وهنقراها مرتين just in case انت عايز تكتبيها عشان الليله لما تحصل انترفيو، لانه في سبيسيفيك تاسك يعني انت خشيتي في حته ثانيه تماما وفي الاخر مثلا الليله انتهيتي بقيت تسالي انت عايز تساليني سؤال شنو، هو ما عندك هو ما عنده علاقه بانك عايز تساليني شنو. هو دي الليله كيس بتاعت او سي دي في الفاميلي هيستوري زي ما انت قلتي يو اوريدي منشند، لكن it's everything else. الليله it's a history assessment, history obtaining a history.
أوكي. ممكن نعيدها تاني لو خلاص.
الزمن بيضايق.
Thank you.
هاي في اي زول
لما
عندكم؟
نبتدي دائما ايوه وي ويل امبروف ان شاء الله. بس في نقطة مهمة عايز انبه ليها هنا. هو لازم الزول يعرف التاسك، وانا قبل كده لو تتذكروا في الاجتماع الفات وفي الموك اوسكي اكزام قلت عدد كبير من الترينيز ما بيكونوا مركزين على التاسك هو شنو كتير. وانا ذكرت النقطة دي لانه حقيقة لاحظناها في كل الامتحانات، يكون في more than one task 1 2 3 please take more history to reach a diagnosis. Then task number 2 please conduct a focused mental state examination. Task number 3 please discuss with your examiner differential diagnoses and your most probable diagnosis. Task number 4 in short give tell your examiner about your management plan. دي الأربعة تاسكس وبعدين كلهم باختصار عايزينهم. فللأسف زي ما قلت بعض الناس والأغلبية الناس بياخدوا التاسك الأولاني ويقضوا فيه الوقت كله ويكون زمن الامتحان خلاص قرب يخلص بدون ما they don't touch the other three tasks. فمهم جدا يا دكتورة هالة وللجميع إنه يا دكتورة هيفاء انه الزول لما يقولوا له اول حاجه يشوف التاسك سواء كان مكتوبه ولا لا. هو دكتور ياسر قبل قال ليك التاسك المطلوب انه history taking and clinical assessment. فكان طوالي تبتدي زي ما انت بديتي كويس في الاول identify yourself وقلت لها thank you for coming here, I'm here to try to help you, وتبتدي تسألي في الهيستوري بتاع الاو سي دي والديوريشن والسيمتومز ولا في اذر سيمتومز برضه. سالتي عن بعض الاسئله زي الفاميلي هيستوري والكلام ده، لكن بقيته كان اكسبلانيشن اوف او سي دي. هم هنا ما كان التاسك بتاع الاو سي دي. لو كان التاسك اكسبلانيشن مع او سي دي you did this well يعني. اوكي، ف there is no problem ان شاء الله.
Thank you. شكرا لكم. ربنا يسلمك.
فممكن يا دكتور ياسر معلش الكيس دي نعيد بس نعيد الأسئلة تانية، بس الأسئلة questions which were supposed to be asked عشان دكتورة هيفاء والبقية يعرفوا إنه لما يكون في كيس أو سي دي زي دي شنو تسأل. دائما في الكلينيكال سيناريو بيدوك في الأول بيدوك short history very short history، وبعدين يخلوك تسأل بقية الحاجات. يعني مثلا لو قال لك this patient has been referred from her GP because of repeated and frequent hand washing. هم الدوكس السيمتوم بتاعت الهاند washing دي بس مثلا please take more history to reach a diagnosis. معناها انت اخذت سيمتوم، قالوا لك سيمتوم واحده، اول شيء تسأل عن السيمتوم دي ذاتها more questions، انه من متى بدت وكم مرة في اليوم وليه why you frequently repeating this hand washing في الأول. بعد ذاك تسأل عن other obsessions و compulsions. انت عارفاها obsessions شنو؟ الواشنج، الكاونتنج، مش عارف ايه، التشيكينج والكلام ده، عشان تقدري تصل الدايجنوز. بعد ذاك بتسأل عن الكومبالشنز، انه الاوبسيشنز دي ولا الثوتس دي are followed by compulsions، يعني هي عندها thoughts that everything is dirty around her and herself and her hands، عشان كده بتغسل ايدين وتغسل روح وتغسل الحاجات الجنبها. زول تاني عنده thoughts او هي ذاتها عنده thoughts she did not مثلا put off الغاز او الباب، ما قفلت الباب، اليو تشيكينج بيهيفير وهكذا. فبنسال دائما عن الثوتس وعن الاكشنز اللي بتتبع الثوتس اللي هي الكومبالشنز، وهاو فريكوينت ات از ريبيتد، ولو ما عملتها بيحصل لها شنو. ده الهيستوري المطلوب ياخذوه، والديوريشن طبعا. وبعد ذاك الاذر اسوشيتد سيمبتوم، عارفين مع الاو سي دي بيحصل انزايتي شديده، يحصل ديبريشن، مش كده؟ تحصل حاجات كثيره، حتى الفانكشنينج والامبيرمنت اوف فانكشنينج وهاو ات افكتد هير لايف والورك والهوم تشورز والحاجات دي. ف لانه لسه عندنا زي 20 دقيقه يا دكتور ياسر، لو بس معلش انت اليوم الاسئله المفروض كانت تسالها للبيشنت دي جاست الكويشنز لو سمحت.
تمام. فهي السيناريو كان لورا هيلس اللي هي lady who has been referred to your outpatient clinic by her GP due to increased anxiety and repetitive behavior. This is taking a significant toll on her work and friendship. Take a detailed psychiatric history of the task. هنقوم الليلة الأسئلة. في قبل الأسئلة كان بيتكلم على الأو سي دي جنرال، وبعدين بيديك مثلا الليلة حبة حاجات للكوميونيكيشن سكيلز اللي هي الأوبن اندد كويستشن reflective listening. أنت الليلة كلمتيني so you told me you came here الليلة مثلا to see me by your GP because you've been dealing with the issue about washing your hands multiple times and it's been very distressing to you, and you've tried several options of our treatment including talk therapy, and the therapy included touching objects, but despite that, you continue to have symptoms. Am I correct? The reflective listening. And normalization في الآخر ممكن الليلة هي discussion، بالذات لما تكون I'm very anxious about dealing with this thing، بالذات هي كانت متوترة في الكلام. أنا ممكن تقول I hear that you're being distressed by your complaints here. I want to assure you that we work with many people with symptoms like yours, and they all come here when we've been able to help many of them with treatment. خلاص. ومثلا الليل I don't want anybody to know and I assure you ان information are confidential. بالنسبة للquestions الsymptoms and an impact. أول حاجة, can you tell me about the thoughts that bother you? Open-ended question. What actions do you feel compelled to perform in response to these thoughts اللي هي الcompulsions. الأول ما كانت عن ال OCD thoughts nature itself. السكند عن ال compulsions. What actions do you feel compelled to perform in response to these thoughts? التالت حاجة how do these thoughts and actions impact your work and friendship. Duration and frequency. When did you first notice these thoughts and behaviors? When did you first notice these thoughts and behaviors? How often do you experience these obsessions and compulsions? بنتكلم عن الأنست، بنتكلم عن progression of the symptoms and the frequency ذاتها كويس. Previous treatments. Have you received any treatment for OCD in the past? When I think you asked here she got lucky and she was on Zoloft ولا sertraline وبعد شوية انت قاعدة تتكلمي عن ال previous treatment واللي هي psychotherapy. كان part of the treatment اللي هي verification لما يقول لك talk therapy. What kind of talk therapy؟ اللي هي قالت لك they made me touch. انت عايز to be specific انه في الاخر is it interpersonal ولا حاجة تانية. فانت هي she told you they made me touch يعني اسمها شنو هي they made me touch يعني dirty things and I was extremely uncomfortable with it, made me anxious and I don't think I want to do this again. طيب part of الليلة بالناس اللي ما تحمل هنا response prevention you can focus on improving the relaxation before the process and يعني and doing it slowly. فانت ممكن تتكلم for people who did not يعني tolerate this. احنا we can help by teaching them some relaxation techniques, deep breathing الليلة هنا deep breathing, or give them medication that can help reducing the anxiety before we perform these actions. But this form of treatment can be extremely helpful and let's try to do it differently this time. خلاص. لكن بتكلم مثلا الليلة what type of treatment, previous treatment, have you received any treatment for OCD in the past? What treatment were most effective or least effective for you? هي قالت لك الليلة sertraline، قالت لك الليلة الهناي، قالت لك القصة بتاعت التريتمنت. Mental health history. Have you experienced any other mental health issues such as depression or an anxiety? Have you experienced any other mental health issues such as depression or an anxiety? Is there a family history of OCD or other mental health disorders؟ اللي هو مثلا OCD, depression, ممكن تكون anxiety problems, bipolar disorder, schizophrenia, ADHD دي كلها can happen. أنا أفتكر لكن it goes as an open-ended question. Functioning and coping. How do you cope with your symptoms? How have your symptoms affected your daily life and the relationships? Safety assessment. Have you ever had thoughts of harming yourself or others? Do you have any current plans to harm yourself or anyone else? فدي detailed questions or depending on what the patient is bringing during the interview. العيانة كانت نوعا ما she was anxious وبعد شوية يعني انت بتحاول تقول حاجة هي بتقاطع كأنها دايرة تتكلم. فانت when you sense the anxiety on the patient, when you can tell her يعني it sounds like you've been very distressed by these thoughts and actions. I want to assure you that many people come in here and we've been able to help many of them with symptoms like yours. And we will be looking forward to work with you just to reassure the patient if you hear the patient is anxious during the interview. حاجة تانية مثلا في الانترفيو لما يكون عندك عيان بالذات مثلا الليلة بيقاطعك لأنه عشان هو متوتر ما قاطعوه. يعني هي افتكر كان في كم مرة كده بتتكلم بتوتر كده ما سمع الكلام ذاته. Try to reassure the patient. لكن مثلا حتى الليلة لو اتكلم العيان أنا بوقف كلامي لحد ما أسمع كلامه هو قال شنو. لأنه بتبقى مثلا communication issue اللي هي لما يحصل مقاطعة كثيرة بين الدكتور والعيان. دكتور عبد الغني عايز تضيف حاجة؟ You're muted.
ايوه ياسر، شكرا لك. يس دي حاجه فيري امبورتنت بالذات في الكوميونيكيشن والانترفيوينج سكيلز. صح، يو نيد تو زي ما قلنا المره الماضيه to have control of the interview لكن without harassing the patient ولا without disturbing the patient or annoying the patient. ممكن البيشنت احيانا مخصوص بنجيب لك بيشنت عنده talkativeness ولا circumstantiality عشان نشوف your ability to interview this patient كيف بدون ما تسيء له يعني او تقول له اوكي. فدي مهمه. البيشنت دي في مرتين او ثلاثه فعلا اثناء ما هي بتتكلم دكتوره هيفاء اتكلمت معاها يعني والصوت برضو أظن ما كان واضح أو الأكسنت، فهي كانت مزعجة البيشنت. ف this is important. الحاجة الثانية دائما في الحالات الزي دي، الامباثي مهم زي ما قال دكتور ياسر. you show the patient انه you can understand what they are suffering of you know that it has been disturbing لكن الكوبينج مهم. الكوبينج بتاع البيشنت دي انا ما بتذكر هي كانت شغاله ولا ما شغاله، لكن حتى في الديلي اكتيفيتيز وفي الشغل يعني تعبتها الحاجه دي، فبنسال عنها.
She was struggling.
نعم.
She was struggling.
ايوه struggling. الحاجه الاخيره التريتمنت اللي اخذتها قبل كده. انا ما اعرف يا دكتور ياسين، انتوا لسه الاكسبوجر اند ريسبونس بريفنشن شغالين بها؟ دي حاجه كانت قديمه افتكر في مراكز كثيره وقفتها بتاعت الاكسبوجر اند ريسبونس بريفنشن، كانت فظيعه.
شغاله لكن يعني ما انا القصه بتاعت مثلا لما السيمتومز تكون سيفير انت بتدي ميديكيشنز، يعني افيلابيلتي بتاعت الميديكيشن اسهل من الثيرابي اليومين دول.
ما في شك، لانه يعني حكايه انه زي بيشنت زي دي اللي عندها obsessions and compulsions about cleanliness، كان بيجيبوا لهم حاجه وسخانه وبالقوه يمسكوها ليهم وهناك ويمنعوهم يغسلوا ايدينهم لفتره، عملت دروباكس كثيره او سيت باكس لبيشنتس كثيرين. في مراكز كثيره ابتدت يعني خلت الاكسبوجر ده والاكسبوجر والريسبونس بريفنشن برضه زمان قالوا كانت مفيده، بس انا اعتقد فيها شويه درجه من العنف شويه يعني.
قبل
لكن
فتره
زي ما اقول
جانا سبيكر بيتكلم
آه
ريسبونس بريفنشن،
ايوه
بيتكلم انه في السنتر بتاعهم عادي كده قام عملها لنا قدامنا، مسك الجزمه بتاعته وقام
امم
هناي يعني اسمه شنو هو قاعد الجزمه والله يكرمكم، قام لحس الجزمه قدامنا قال لنا
اها لا حول الله. ايوه صعبه
just to make a
يعني
point.
دي. ايوه لكن بقول لك دي زول النورمال ما بيتحملها. خليك واحد عنده او سي دي، يعني حسي في ناس نورمال ما بنستحمل حاجه زي دي. انت زول نورمال لكن ما تستحمل حاجه زي دي. فهي الاكسبوجر والريسبونس بريفنشنز في ناس كثيرين عندهم راي فيها anyway. لكن انا اعتقد we are going to improve no doubt. We have already improved no doubt. تحسنا كثير. انا عارف انه في بعضنا يا دوب الدفعه 50، يعني لسه الناس نحن مقدرين انه لسه ما they were not really exposed to a real training لكيسز كثيره. لكن شويه شويه ان شاء الله we can get there، نصل الحته اللي عايزينها ان شاء الله. نعم. ولو في اي ملاحظات الله يحفظكم الله يحفظكم، لو في اي ملاحظات تانية ممكن نستمع لها. we do still
لو سمحت يا بروف، عندي addition و question حقيقة. I would like to add يعني في when we take history of OCD في حاجة ممكن نسأل منها ثاني اللي هي depending على إنه the most common obsession is cleaning و the most common compulsion checking. فإحنا نسأل منه أسأل البيشنت عندها cleaning problem، فهل برضو نسألها برضو مسألة إنها يكون عندها هل عندك بروبلم بتاع تشيكينج اللي هو يعني تشوف الباب مثلا
ما
مقفول
ده اللي قلت
ما
هذا
قبل
اللي قلت
كويس.
قبل شويه لهيفاء ليكم قبل شويه قلت لكم كده، ما دام هي عندها واشر نسال عنها تشيكينج.
أيوة تمام
قلناه قبل شويه تشيك الباب، تشيك
تمام
الغاز، تشيك المكيف قفلته ولا ما قفلته، الانوار الكيس.
أوكي. وسؤالي برضو لما نسأل عن الأوبسيشنز حقت البيشنت، أنا في بعض المصادر بلقاها مع المود، في بعض المصادر ده في المنتال ستيت اكزامينيشن بلقاها مع المود أحيانا، في بعض المصادر بلقاها مع الصوت كونتنت. ف يعني الكلام ده هل يعني كويس ولا ممكن أحسن ناخدها مثلا في مكان دون مكان تاني يعني؟
يوجوالي مع الثوت
بحيث
كونتنت. الثوت كونتنت دي اهم حاجه في الثوت كونتنت. لو البيشنت لو كان سايكوتيك ديلوجنز، الديلوجن دي ثوت كونتنت. الاوبسيشنز بعدك thought content، البريوكيبيشنز thought content. فنحطها الثوت كونتنت دي بتاثر على المود لو كانت اوبسيشنز ولا وات ايفر ات از، فالمود برا، ولكن ما الاوبسيشن ما بنحطها في المود. انا ما حصل قابلتني اوبسيشنز في المود، ربما قابلتك somewhere لكن ما قابلتني.
اوكي تمام، يعني مع الصوت، مع الكونتنت، صوت كونتنت. اوكي ثانك يو. بس
طيب
يس مع ثوت كونتنت. يا خلف الله، شكرا لك.
العافيه. بس الله يكرمك.
أي حاجة تانية قبل ما نختم الليلة، ونتمنى التوفيق المفروض للناس الممتحنين هسه في البروموشن 1، وتاني هو بروموشن 1 والفاينل، مش كده هو؟
ايوه، بروموشن 1 اكزام 1 day، بروموشن 1 2 papers 1 day 25th of current December، و a written part of the final MD at the same time، متزامنات مع بعض يوم 25/12. ورقتين للفاينل MD، الورقة الأولى one best answer 150 questions، والورقة الثانية 15 questions standardized short answers question SSAQ. فبيخشوا مع بعض كلهم في نفس القاعة، ناس بروموشن 1 وناس MD. ناس MD those who succeed إن شاء الله كلهم، those who succeed in the written part the two papers بنجمعها مع بعض. those who pass the two papers they proceed to the following day للأوسكي then the clinical exam. الكلينيكال two parts، البارت الأولاني أوسكي 10 أوسكي stations، والجزء الثاني one long case 1 hour with a real patient. الأوسكي مع simulators طبعا، لكن we are still يا ياسر keeping a real patient interview في الفاينل MD exam. I know a lot of programs و colleges و lecture و centers يعني أو MD أو fellowship في الدول العربية وفي بريطانيا، وأظن عندكم في أمريكا. they have moved from a real patient، لكن احنا we are still keeping a real patient. وزي ما قلت لكم قبل كده لما جبنا examiners من الرويال كوليدج اوف سايكاتريست اوف لندن، بروفيسور بيتر هيوز بتذكروا، بروفيسور باتريشيا كيسي، كلهم جو الخرطوم هناك وامتحنوا بعض الدفعات القديمة. they were very happy انه we are keeping a long case، لانه كلهم ونحن كلنا امتحنا في long case زمان، ما كان في حاجة اسمها اوسكي، ما كان في حاجة اسمها فقالوا للأسف نحن بس بنتابع اللي بيعملوه الكنديين والأمريكان، غايته الصوت وصلكم انتوا، أي حاجة تعملوا أمريكا أو كندا الناس كلها ماشية وراهم. فقالوا خلاص لو السبيشاليتيز الثانيه مشت للكاسك وللاوسكي maybe it suits them، لكن in psychiatry we need to see a psychiatric patient. فالحمد لله احنا احتفظنا بيهم الاثنين. بقى اخذنا الاوسكي حق الامريكان والكنديين، وخلينا الاوسكي اللونج كيس بتاعت الانجليز برضه. فدي بتعمل ريال مور اسسمنت للكانديديتس، وفي النهايه اصلا هدفنا انه يكون عندنا a safe psychiatrist، ما اكثر من كده. and people will improve and will learn more and more إن شاء الله. ونتمنى التوفيق للجميع نحن.
إن شاء الله موفقين كلكم إن شاء الله، ونتمنى نشوفكم في هنا السنة الجديدة إن شاء الله لما نجي راجعين. لكن أفتكر السنة الجاية الاستفادة من الكلينيكال التريننج هيكون أكتر من الفترة اللي فاتت دي. الفترة اللي فاتت دي كان في افتكر في فترة بتاعت الناس تتعلم السيستم what to do what not to do. الفترة الجاية حتكون بتاعت implementation للشغل اللي تعلمناه هسه. فإن شاء الله موفقين، ونتمنى نشوفكم على خير إن شاء الله.
إن شاء الله ياسر. وحقيقة نكرر الشكر لدكتور ياسر ودكتور عبد العظيم والناس اللي بتشارك دائما. لكن برضو ملاحظة أخيرة لكل الموجودين دلوقتي، شكرا لكم وشكرا لحضوركم. لكن do you believe إنه الحضور اليوم في الأربعينات، 40 نفر، 47 48 50، طلع واحد دخل واحد، ما فات ال50، ما فات ال50، وأنا عندي 104 متدرب مسجلين عندي. فحقيقة يعني يا إخوانا للمرة الأخيرة قبل ما نخش في العام الجديد ان شاء الله، انا عايزكم تجتمعوا مع بعض. ما انتم كلكم متدربين and you can understand each other, you can talk to each other more freely مننا في لجنة النواب ومع كل المتدربين. We just ask ourselves one question: ليه حضورنا ضعيف؟ بس عشان ما نتهم زول من الاخر. الحضور طبعا مسجلين انه ايوه عارفين ان احنا الحضروا 0% والحضروا 5% والحضروا 20 والحضروا 100%، ده عارفينه. عندنا مقياس له، وفي بوينتس. الناس اللي بياخدوا بوينتس يعني. لكن بس نحن يعني كونه دكتور ياسر ده الليله شغال، دكتور ياسر الليله شغال ويفرغ نفسه من اي حاجه ويجي يحضر السيشنز دي كلها. الجريتفولنس ما عايز حاجه يقول له شكرا. الحضور، بس الحضور كونه يحضر اكبر عدد. يا لجنة النواب يا دكتورة لينا في لجنة النواب اللي كان طلبت، وانا اشكرها، طلبت انه نعمل 2 or 3 sessions per week. قلت لها نحن 1 session per week ما في له ريسبونس. لو لقينا ال100 بيحضروا بنعمل لهم 5 sessions per week، ولا شنو يا ياسر؟ مش كده؟
وبعدين زي ما كنا مدورين
بالضبط. يعني نحن اول ما بدينا في شهر 7 2023 كنا بنعمل خميس جمعه سبت احد. تتذكر يا ياسر؟ جمعه سبت احد 3 مرات في الاسبوع والله كنا بنعمله. حسي بنعمله مره واحده في الاسبوع. الليله يجوني 47 من 104 يا اخواننا. يعني it is a big question. عملنا سيرفيز وسالنا، لكن انا عايزكم انتم براكم تناقشوا القضيه دي. عندكم حسي اسبوعين 3 اسابيع ما فيها اي سيشنز، اقعدوا مع بعض وناقشوا. شوفوا زملائكم اللي ما بيحضروا ديل ما بيحضروا ليه. يمكن ما عايزين يقولوا لنا، يمكن يقول، يمكن بعد شايفين السيشنز بتاعتنا دي يوزلس ما منها فايده. ما في مشكله يقولوا لنا والله ما فيها فايده، نحن وي كان امبروف اور سيلفز، مش كده؟ لكن عدم الحضور بس this is a very passive behavior. الباسيفيتي ما كويسه يا شباب. انا بشكركم انتم الحضور، لكن بتكلم عن الناس اللي ما قاعد يحضروا. فبليز بليز discuss with them. واتمنى، وانا ودكتور ياسر ودكتور عبد العظيم وكل ناس الترينرز، انه 2026 الحضور ما يقل عن 90%. نتمنى كده. شكرا لكم وعام سعيد وربنا يوفقنا. بنديك كل التفاصيل من بور السودان يا دكتور ياسر. احنا حنسافر بعد 10 يوم تقريبا من الان،
بالسلامة
او
إن شاء الله.
8 يوم. بعد 8 يوم حنسافر ان شاء الله على السودان. يديك العافيه. قبل الامتحان ب4 يوم كده او 3 يوم.
بالسلامة إن شاء الله.
ربنا يحفظكم جميعا.